everybody, and welcome to the Practitioner's Edge, the Nutrition Collective's podcast that brings you cutting-edge insights from leaders in functional and integrative medicine. I'm Louise Ritchie. I'm the Head of Education and Strategy at the Nutrition Health Collective. And today we're diving into a condition that affects 1 in 10 women, yet remains widely misunderstood, endometriosis. I'm joined today by someone who is truly rethinking and revolutionizing how we approach this complex condition. Welcome, Dr. Ghazala Aziz Scott. Dr. Ghazala is the clinical lead doctor at the Marion Gluck Clinic and a leading expert in hormone balancing and functional medicine. Dr. Ghazala brings over 2 decades of experience as a senior NHS GP and is certified by the Institute of Functional Medicine. With medical degrees from both Cambridge and Oxford, her approach combines cutting-edge science with a deep understanding of the body's interconnected systems. Ghazala, I know you work closely on an array of conditions around perimenopause, menopause, PCOS, adrenal fatigue, and endometriosis, and that you're always seeking to uncover root causes like immune dysfunction, gut imbalances, and chronic inflammation. Thank you so much, Ghazala, for joining us today. And I know that you are keynote speaker at the symposium that we're having on the 25th of June, where we're really doing a deep dive with both yourself, Kat Smith from KBMO, and Lorna Driver-Davis from Wild Nutrition. So today we're kind of just doing a little bit of a light dive into some insights into this condition and what people will be able to then learn more on the 25th of June. To kick us off, would you mind sharing with us a little bit about your journey into functional and integrative medicine?
Sure. So, hello, and thank you very much for having me on Nutrition Collective. It's a great privilege to lecture for Nutrition Collective. I think that it's such an amazing organisation, and the speakers and the educational material that we learn in this forum is just next to none. So it's really a real privilege to be part of it. So, as you mentioned, I started off doing my preclinical studies at Cambridge, and there was a very strong scientific basis to that training, which it sort of helps me in my work up to today. I then did my clinical training at Oxford, and then I was a GP for about 2.5 decades, actually. And I was a partner in the NHS. So I followed women through their health journeys, right from, when they were sort of, teenagers up to when they, got pregnant, had children, into the perimenopause. So I really feel that I have a very strong understanding of the female life cycle in practice, because I've seen it, in all my patients, and I followed them through the decades. In fact, my own growth as a woman, from, when I first started in general practice to when I've had children to when I've become perimenopausal and menopausal. So, it's all really useful knowledge. So I loved being a general practitioner when in the days you could actually be a proper family doctor, and when there was real continuity of care, and I had time with my patients. And I was finding increasingly that we were just given such a short period of time, we were just focusing only on symptoms, and we weren't really understanding the deeper causes behind which why people were getting ill. So I actually went on a GP refresher course, and it was a 5-day course with all the different specialities. And what was interesting is that all of these specialities, the sort of end stage medication was an IMAG drug, which is to tackle inflammation. So it just sort of made me realize that all of these different specialities, the underlying root cause for a lot of these diseases where they couldn't be managed was tackling inflammation, giving people these very strong medications that tackled chronic inflammation. And I thought, well, why aren't we actually looking at why people are getting inflamed? And it was a real light bulb moment. And at the same time, I went across to Seattle to the Institute of Functional Medicine introductory course. So I did that 5-day course, and that was just like a light bulb moment. And I sort of instinctively practiced that style of medicine as a family doctor, where I was seeing people all the time. But now, I just love the framework that we were given to actually put this style of medicine into practice to really help us understand how do we look at root causes and how do we then manage those root causes, and to actually see the body as a number of systems. So it's a systems biology approach. So what you do realize in modern medicine, the way the medical education is structured, and everyone, it's people are intelligent, they're competitive, they want to go into their different specialities, and with each of these specialities they learn more and more and more about less and less and less, and everyone's got to do a PhD in a very small, an area of speciality of their specialism. And in a way, what happens is people sort of they stop thinking about the body as a whole, and they only think about their unique little system. So a gastroenterologist will only think about the gastrointestinal tract, neurologist will only think about the nervous system, and there's nobody to put the whole thing together. And that was one of the things that was amazing about being a general practitioner in the true sense of the word, when you were really looking after your patients and you had continuity of care, is that you could sort of put all of this information together and come up with some ideas. But functional medicine training actually formalized that for me, and also it helped me understand that sort of specialization. I mean, obviously it's got its advantages, but there are also disadvantages in having a more holistic approach to helping patients. The other thing is that you realize the pharmaceutical industry really, really drives a lot of what we do in medicine. And that's quite scary, really. I mean, even so, at the same time that I trained in functional medicine, I went to the personalized medicine and personalized hormone treatments, and the specialist pharmacy that's attached to the Marine Clinic, personalized dose naltrexone and lots of different things. So it was actually, interesting that actually working in this much more personalized way was actually something that, conventional practice disagreed with. So, when you look at the guidelines for the British Menopause Society, it's that you've got to use these standardized, regulated bioidentical hormones, which, the NHS is amazing that everyone has access to some form of treatment, but it's not necessarily the gold standard. And what's frustrating is when they make it out that it is the gold standard, and that when you're doing things in a personalized way, just because you haven't got a controlled clinical trial, it doesn't mean to say that there isn't some benefit in that form of treatment. And when I like that sort of that idea that evidence-based medicine has got to be a combination of clinical research, the patient experience, and the practitioner intuition and experience. So as a doctor, who's been practicing for like 30 years, when I see patients with hormonal issues, I just have this instinct of what's going to work for them, because my brain's processed hundreds and hundreds and hundreds of cases. So I have that instinct of what's going to work for this person. And that is largely ignored when you're looking at guidelines. And what was really interesting is the millions and millions of disease classifications we have. So in modern medicine, we tend to want to label everything. So we want to label everything as, this is an illness, this is the symptoms, these are the signs and symptoms, these are the investigations, and this is the treatment. Now, the way that we manage that big pool of information is to develop protocols. So once you've formed a diagnosis, you then look at the protocol and then you follow it, and it's actually not really using, creativity, your imagination, your intuition. It's not using all those sort of soft skills that are really, really, really important, and also understanding your patient.
And also what I'd like to just touch on there, actually linking it to endometriosis, you talked about in the NHS, in private medical healthcare in general, you specialize in a topic, and that is the area that you specialize in, and so you're unable to look at the holistic view. And like you say, it's not only your gut instinct and your years of experience and your years of interaction with different patients, but is it because you're also having that broad view that you're not necessarily missing out on or misdiagnosing things? Because I think endometriosis is quite often misunderstood, misdiagnosed. And do you think that's one of the kind of the issues for that
Yeah,
misdiagnosis.
absolutely. I mean, when you're thinking about endometriosis, in sort of conventional medicine, it's kind of viewed as a thing. You've got these little deposits of endometriosis in different
Mhm.
areas of your body, and you either some of the conventional treatments are that you block ovulation because hormones
Mm.
stimulate these deposits. So you either put people on the pill, or you put people on a GnRH analog, which closes down the HPA axis, or you give them some progesterone, or you chop it out.
Yeah,
So
yeah,
no one's looking at, what goes on underneath it. So, if you're going to put someone on the pill, well, what when they want to come off the pill? What if they've got side effects on the
yeah,
pill? So you're actually masking what could be driving the
yes,
endometriosis. When you're chopping things out, so even, the Cochrane reviews and research has shown that surgical removal of endometriosis, of the endometrial deposits, does not necessarily result in an alleviation of symptoms. And certainly
mm,
the recurrence rate is very high. So you might chop out some of the deposits, but you're not dealing with some of the root
yeah,
causes
yeah,
that are driving the disease, and therefore could damp it all down and prevent recurrence. So you get recurrence. And then, when all else fails, it's, well, let's just whip the whole lot out, and let's
yes.
give people a hysterectomy and take their ovaries out, and then you're putting people into a surgical menopause. So it's quite a crude way of looking at it,
Mm,
I feel,
yeah,
having now studied the functional approach to endometriosis and really having a very deep understanding of the drivers behind it. And you realize that, you can label someone as having endometriosis, but actually what you need to do is, for each individual woman, you need to look at, well, for this particular woman, what are the key drivers? What can we do to improve endometriosis for this person?
yeah.
So it's a blanket term, and it does refer to deposits of endometrial tissue in locations other than other than the endometrial lining. But for different women, there will be different drivers of what's causing that.
Absolutely, absolutely. And actually, also, I read some research recently around, the links with other conditions. So,
Yeah.
it's known as a chronic inflammatory disease. So there's often endometriosis linked with rheumatoid arthritis, chronic fatigue linked to it. So again, if you solve, or if you think you're solving the problem by cutting out the endometrial tissue, you're not solving the problem. And there may be other problems at risk that, again, if you look at those in isolation, you're just doing quick fixes for each of those. You're not looking at the whole body, which you
So
look at the whole body.
exactly. So therefore, you're looking at imbalances and root drivers that are then affecting other aspects of their health as well.
Mm,
So for someone with endometriosis, they very often have coexisting mental health conditions, because it's enormously disabling to have pain every single month.
yeah,
Disabling pain affects their quality of life. A lot of women are infertile or have fertility
yeah,
issues. So they've been through cycles of IVF, and once they know they've got endometriosis, they think, oh, I might be infertile. So there's that. Also, we know that one of the drivers of endometriosis is gut dysbiosis. Now, we
hmm,
know that we have a gut-brain axis. So therefore, if you've got dysbiosis that's driving endometriosis, you will also have dysbiosis that might be driving psychological imbalances and mental health
yeah, yeah,
symptoms. So by actually looking at those root drivers, you're going to be helping people in many, many ways. I mean, so a lot of my women who've got complex endometriosis, they've got a trauma history. So we know
yes,
that, how does trauma manifest in the body from a physiological point of view? So we know that once you've got traumatic childhood experiences that have dysregulated the HPA axis, you've got abnormal cortisol patterns. You know that those high cortisol patterns that someone may have had when they're going through this trauma has caused leaky gut, has caused dysbiosis. We know that inflammation, a chronic inflammation and immune dysregulation is also a function of people who have had a lot of trauma.
yeah,
So once your HPA axis is dysregulated, in a way, your body's in a survival state. So your body goes, right, I've just got to survive. I'm not going to worry about my immune system and my other physiological processes too much, hormone balance, because I've got to focus on survival. So
Yes.
therefore, that person is much more compromised in all aspects of their health. And we know that people who've had ACEs or adverse childhood events do have an increased risk of ill health later on in life.
Yes.
So, trauma is a massive issue. And so unless we look at, help the patient understand their story, why have they got endometriosis? A lot of people don't even realize they have trauma. A lot of people don't realize how trauma has had an impact on their physiology. So even through helping the patient understand their narrative, why are they where they are? And what can we do about it? I think it's very empowering. And, people like to have, answers and an understanding of why their health is where it is.
Yeah, absolutely. And also, by addressing that trauma, you're addressing lots of other issues. And would you say that because this is a kind of multidisciplinary approach, how do you work with other kind of practitioners in the field to support your clients?
Sure. So I work with a fantastic nutritional therapist who specializes in sort of women's health conditions, and she's actually done some training in endometriosis. So once I've sort of assessed a patient, I've maybe done some testing on them. I'll do a Dutch test. Maybe have done a functional gut test of some description.
Yeah.
Then just say they've got dysbiosis and they've got issues with their gut. And also, very often there are sort of dietary issues that
Yeah.
need to be addressed. Then I'll refer them to my nutritional therapist who I work with, and she'll do a gut restoration program and, offer sort of more support, because I can only see people, for an appointment, for a follow-up. But very often these people need to be held in these situations where there's quite a lot going on, it's quite a lot for them to process.
Yeah.
For me, I can go through a Dutch test and a functional gut test in 10, 15 minutes, and now I've just processed it all, because that's what I do all the time.
Yeah.
But for a patient, these big whopping 18-page reports, it can be
Yes.
quite overwhelming.
Yeah.
So therefore, having someone to support you in helping that patient understand where they're at, and to support them through some of those stages like a gut restoration, or to improve their nutrition, to an anti-inflammatory diet, discuss what supplements to put them on. A lot of patients are adrenally dysregulated, so therefore I will put them on an adrenal support protocol. My nutritional therapist will help look at what lifestyle factors might be impacting that, what can they do to improve that. We'll be looking at things like, is a patient overweight and therefore estrogen dominant? If you're estrogen dominant, that's going to drive endometriosis. If you're overweight, you're going to be insulin resistant. Insulin resistant then doesn't help your adrenal axis.
Yeah.
It doesn't help your inflammation.
Yeah.
So it's sort of unraveling things, and that takes a lot of time and energy and
Yes.
effort, and the patient needs to be supported. You can't just say, right, here's a whole list of supplements, off you go,
No.
just work your way through that. You've got to be much more specific and structured in how you deal with people. When I've got people who've had trauma, we know that a lot of talking therapies can actually
Yes.
be re-traumatizing. So it's actually understanding that a patient might need some more body work. So if someone's got a dysregulated HPA axis, I've got a couple of really good acupuncturists who I work with,
yeah.
who I find they're really good at helping the HPA axis rebalance, and helping with hormonal issues. A lot of people with endometriosis can have a sort of heightened pain response.
Yes.
So acupuncture can help
Yeah.
with all of that. Then there are I've got an osteopath colleague called the functional osteopath, who I find very helpful, again, that sort of functional approach. I've also got some really good trauma therapists who I work with. So depending on, the nature of what their trauma is and what their
Yes.
psychological patterns are. Some people have an underlying psychiatric diagnosis. They might have endometriosis, but they might also have an underlying psychiatric diagnosis. Very often people who've been traumatized and have developed these complex hormonal conditions like endometriosis, they might also have PMS or PMDD. Because a lot of my PMDD patients also might have a root cause of trauma. So there's a lot of overlap between gynecological issues
Yes.
like fibroids, and menorrhagia. All of those things can overlap with a diagnosis of endometriosis. So having that understanding of everything
Yeah.
can be really beneficial in really, analysing exactly what the patient's problems are, what those root drivers are, and then what can we do about it,
Yeah.
and starting from the basics,
Yeah.
really.
And as you say, what you've just described there is such a kind of interconnected web that you
Mm,
need to unravel and understand, and will be so individualized.
mm,
It's not a one size fits all approach, and you
not at
need
all.
a huge amount of time to be able to unravel
Exactly.
all of that. And it's not a consultation which takes 10 minutes. Tick, we know
No.
what you've got. Off you go. With this
Yeah, I
pill.
mean, our initial functional medicine consultation is like 75 minutes. I often go on for 90 minutes,
Yeah.
depending on, how complex people are. And, they've often come with hospital letters from lots of different consultants. And it's just fascinating to see how, people are just looking at things right on the surface. Like, I was at a dinner party on Saturday night, and I was chatting to a consult neurologist who deals with fertility issues in
Okay.
men.
Yeah.
And saying, "Oh, well, do you deal with men as well?" I said, "No, we do male testosterone replacement and stuff." And I said, "But we have a functional approach. So I'm always looking at, well, what's driving that testosterone imbalance? With men, metabolic health is very closely linked with their hormone balance as well. So I'll be looking at the other factors that could be driving this." And he goes, "Oh my God," he said, "this is music to my ears." He
Yeah.
said, I don't come across many doctors who are interested in what other factors might be happening. People just want a quick fix. They know, I've got low testosterone, I want a quick fix. I want a prescription. So I think people are beginning to really appreciate the benefits of functional medicine,
Yeah.
and that whole body approach. Humans are complex, and when you've got a functional medicine case and you map it onto the functional medicine matrix that the
Yes.
IFM
Yeah.
give us, which I'm when I do my talk, I show the matrix and how we use it, and each time I do that, it sort of stimulates my brain cells to see things in different ways. But it's
Mm.
having these sort of models of how we can look at people's problems, like the functional medicine matrix, which should be really, really helpful both for the doctor and for the patient, because you're not following a protocol, you're analyzing something on a much deeper
Yes.
level.
Yeah.
And then you've got to make a protocol that's specific for that patient. So
Yes.
it's a personalized
Yeah.
treatment plan.
Yeah. And you're looking at all the different systems and how they might be interconnected and how they might be aggravating the condition, to then again put the bigger picture together, because it might not be operating in isolation. There might be other factors that will be different for each individual that sat in front of you. And I think what we mustn't kind of also ignore, you've also talked about, the impact that this condition has on an individual, the repercussions of that in endometriosis, as you said, about fertility and the impact of infertility, the pain. We can't ignore the fact that impact that has on that individual in their day-to-day life, in their working life, and how can they, manage that effectively. And I think, there's been a lot in the press over the years in terms of menopause and the impact on menopause on individuals. And this needs to be kind of addressed in the same way,
Yeah,
and
yeah.
not ignored. And actually, interestingly, Lorna Driver Davis, who's also going to be at the symposium on the 25th, from Wild Nutrition, she's looking at actually endometriosis cases and going through perimenopause and how to manage those, I won't say conditions because perimenopause isn't a condition, but
No.
how to manage that at the
Well,
same
well,
stage.
if you're perimenopausal, you're more likely to be estrogen dominant, and estrogen dominance is a driver of
Mm.
endometriosis. And progesterone resistance or deficiency is also one of the sort of drivers. So that's a classic perimenopausal hormonal imbalance that occurs. So, very often endometriosis could be a lot worse then. I mean, I think the thing to remember is that it's grossly underdiagnosed, and women report having seen about 2 or 3 practitioners before someone makes that diagnosis. And it's got an enormous morbidity, for the National Health Service and for people. It's also the number of hours that people lose in work,
working hours,
through their severe symptoms. And, when people need very complex surgery, when people have got sort of very, very severe endometriosis, sometimes they need bowel resections and stomas and all sorts of things. So it can be really, really difficult. So by addressing those root causes, by early diagnosis, addressing those root causes, supporting women properly, acknowledging what's happening to them, you can actually damp it all down, significantly, really. And you're and through the good health practices that you're teaching your patients, like an anti-inflammatory diet, exercise, moving, addressing stressors, addressing trauma, you're sort of helping their overall health improve as well.
And you also mentioned about, again, adding to the picture by, you do the Dutch test, you do some gut testing.
Nutrigenomics.
Because Kat Smith from KBMO, who's representing KBMO Diagnostics, will also be doing a talk on gut barrier and immunity and endometriosis, and kind of looking at LPS-driven inflammation, impaired gut integrity, and those as key drivers. But again, it's doing those tests to give yourself the bigger picture as well of your client.
Absolutely. And, if we look at the gut as the central axis of health, if you do a gut restoration program on someone who's got an imbalanced gut, you're going to be helping every single aspect of their functioning. We talked about how there's an overlap between autoimmune conditions and endometriosis. So we know that immune dysregulation is at the heart of, one of the drivers of endometriosis. And then we know that autoimmune conditions have got immune dysregulation as a driver of that. So women who've got endometriosis are much more likely to have rheumatoid arthritis, SLE, celiac disease, so many other autoimmune conditions. So by managing their gut health and by reducing those drivers of dysregulated immune system, you're going to be preventing them from developing autoimmune conditions. It's so interesting when I went to the introductory course in Seattle, there were a lot of doctors on there who reversed their own Hashimoto's through the functional medicine approach, and that's got them hooked. It was like, oh my god, I can reverse my own Hashimoto's. I need to find out more about functional medicine. So yes.
So as you say, this integrative approach, which has become a bit of a buzzword, but this integrative approach, you're not looking at one thing in isolation, because you're looking to see, right, well, this could be a driver, this could be a driver. So we need to look at all areas of the body and all areas of the systems of the body to alleviate, this one condition, but it will have a knock-on effect on the overall health and well-being of your client.
Yeah, absolutely. Absolutely. And also teaching people about, endocrine disruptors. What are they putting on what are they putting into their bodies? What are they putting on their bodies? All those sorts of things that could be really having an impact. And then, looking at much more holistic ways of treating people as well. So, if they've got a dysregulated HPA axis, there are lots of adaptogens that we can give people if they've got, gut issues. We can do gut restoration, teach people how to eat healthily, what they should be doing. If people have got SIBO, we can manage that. Micronutrient deficiencies, glutathione deficiencies. There are lots of supplements that are anti-inflammatory. There's a lot of foods that are anti-inflammatory. So things like fresh ginger, turmeric, herbs and spices, those are all anti-inflammatory, natural herbal antimicrobials. So by teaching people about how they can, in a natural way, improve their diet, make it anti-inflammatory, what sort of foods should they be adding in, what supplements are specifically going to help whatever their root drivers are. Is it an immune thing? Is it autoimmune thing? Is it adrenal dysregulation? There's so many different ways that we can support patients that's holistic and that doesn't have adverse side effects. putting people on things like a GnRH analog, to block their HPA axis, you're literally putting women into an early menopause. So what you're not then appreciating is that, yes, hormonal dysregulation can result in endometriosis, but hormonal balance means that all those sex hormones that are really, really important for our health can work properly. We need progesterone for our mental well-being. We need estrogen to support our bones and our heart and our brain function, and testosterone to support our muscles. So, we need those hormones. But we need them to be regulated. We often say that the menstrual cycle, a healthy menstrual cycle with, a good flow, regularity, and no pain is a barometer of health. If you've got that, then that means you're probably healthy.
Yeah, absolutely. Thank you, Ghazala. I'm going to leave it there because that's been a very good overview of endometriosis and integrative functional medicine practice. And I know that on the 25th, you'll be diving much deeper into the topic of endometriosis. And as I mentioned before, we'll be joined by Kat Smith from KBMO and Lorna Driver-Davis from Wild Nutrition, who will be exploring, as I said, the perimenopause alongside endometriosis, the drivers, immune integrity, gut integrity from KBMO and Kat Smith. So thank you very much, Ghazala. Thank you for sharing your expertise and spending your time with us today, and for offering such a powerful and systems-based approach and view of endometriosis. For everybody listening, the full session from Dr. Ghazala will be taking place on the 25th of June. It's an online symposium starting at 4 p.m. UK time, and we'll be going into a much, much deeper dive of the topic then. If you want to get your ticket, if you go onto the Nutrition Collective website, go under events, and you'll find the event listed there. So please do buy your ticket and join us there for a wonderful evening of amazing experts in their field. Thank you for tuning into this episode of The Practitioner's Edge. And until next time, stay curious and keep learning. Thank you.
Thank you.